Well, for the first time, several herds of dairy cattle in the United States have tested positive for bird flu. And just days after a group of goats contracted the bird flu in Minnesota, the USDA says the infected cattle have been found in Texas, Kansas, and Michigan, with preliminary positive test results reported in New Mexico and Idaho. Right now, the federal government says the contaminated animals are being isolated. Their milk production is being destroyed before making it into the food supply for consumption for people like you and me. So joining me now is News Nation medical contributor Dr. Dave Montgomery. Dr. Dave, it's always good to have you. The thing to reiterate here right off the top is that the USDA and agriculture experts are saying there's virtually no impact on consumers so far. But how worried should we be about something like this?
Yeah, good morning to you, Marky. Yeah, it's a big concern, and at least we should be on alert. The FDA is also very clear about this, that there has been no transmission of this avian bird flu to humans from a sort of milk source. The really important thing to note is that only the raw milk products, right, milk itself and other products, would be at the highest risk of transmitting it if it were to occur at all. Remember, we don't have any cases of where it occurred because a large majority of the milk and the milk products that we consume here in the States is pasteurized, that process by which you heat the milk and kill many of the viruses and bacteria.
Yeah. Okay, so what are some of the things consumers should keep in mind when buying dairy at the store right now?
Yeah, I'm going to tell my patients, I'm here in Georgia, I'm going to tell my patients, let's stay away from raw milk products at this point. Although we don't have any cases of it, it could be either underreported or just not there. There's no reason to expose yourself to the risk of bird flu, and so stay away from those products. And then just be looking out for, symptoms that remind you of the flu so that you can get attention sooner than later.
And elaborate on that, because I was wondering that this morning. If I were to catch the bird flu, what would that actually look like?
Yeah, there's that range, just like many of the other flus. Some people have very, very mild symptoms, runny nose, body aches, fevers. And then other people can become quite ill from things like the bird flu, particularly this strain that we had historically, the H5N1, where hospitalization is required, not able to keep down fluids and blood pressure dropping, things like that. You want to be the person who is saying, hey, listen, I've got a fever that's not normal. Let me call my doctor and see what I should do next.
Okay. And listen to your body and then go to the experts. Dr. Dave Montgomery, it's always good to have you. Thank you so much. Thanks for watching, everybody. Go to joinnn.com to find News Nation on your television provider. Also, don't forget to click that red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.
This morning, the FDA insists the nation's milk supply is safe after fragments of the bird flu virus were found in some milk samples. The Washington Post reports the fragments were found in samples taken from grocery stores in the U.S., but officials have not said where.
This may indicate that the outbreak among dairy cows is wider than what we thought. As of right now, this does not pose any threat for the individual, meaning fragments of a virus, if it's found in your milk, can actually cause disease.
The FDA says the commercial milk supply is safe in part because of pasteurization, which heats milk to a specific temperature for a period of time. Officials saying even if virus is detected in raw milk, pasteurization is generally expected to eliminate pathogens to a level that does not pose a risk to consumer health. In Ohio, where it's believed the virus is coming from other states, infected cattle are removed from the production line.
That milk is not ending up in the milk supply.
Bird flu cases have been detected in cattle in at least 8 states, from Idaho to North Carolina. In Texas, a farm worker was infected, believed to be only the second human case ever in the U.S.
As of right now, we don't have any cases of human-to-human transmission. But if a flu virus such as H5N1 mutates, and it's able to spread from animals to humans, this could lead to more illness and potentially a flu outbreak.
For the everyday consumer who has milk in their coffee, has cereal for breakfast, is it safe to continue business as usual?
I would recommend that anyone who is using milk on a daily basis uses pasteurized milk, and you are good to go.
Again, the FDA recommends that you do not consume raw milk or dairy products that have not been pasteurized. The agency says more testing is underway, including in fertilized eggs. Results are expected in the coming days or weeks.
If you're sitting down to dinner and pouring a glass of milk for yourself or your kids, you may want to know about some new information released by the Food and Drug Administration. The agency says it found bird flu in milk sold in grocery stores. The FDA says it thinks lab tests detected remnants of viruses that had been killed during pasteurization. But experts don't believe those remnants could make people sick. The USDA is conducting more tests to be sure. The bird flu was detected in cows in 8 states, those shaded in red on this map. That includes Texas, Ohio, and North Carolina. Wisconsin is not one of them. The closest to us is Michigan. And now the U.S. Department of Agriculture is requiring dairy cows to be tested for bird flu when moving in between states to try and stop this spread. The order goes into effect on Monday. New at 6, Chloe Morrissey is at a dairy farm for us tonight, hearing firsthand the risks and precautions needed at this time.
The U.S. Department of Agriculture is looking into the possibility that HPIA, also known as bird flu, may continue to spread through farms, affecting livestock. Recently, a group of birds carrying the flu infected 33 cow herds across 8 states.
The animal industry as a whole are just kind of on heightened alert.
Plus, new reporting from the FDA says that fragments of the flu have been found in pasteurized milk, but that there is no danger of drinking store-bought milk. Katie Schultz knows all about the pasteurization process. She is one of the co-owners of Trifecta Farms. With about 500 cows on the farm, she also knows the risk in a situation like this.
When something like this happens, it's just an opportunity for us to, 1, review our biosecurity, and 2, it gives us an opportunity to just make sure that, you're paying that extra attention to those animals.
Here at Trifecta Farms, this news does put them on alert, but their main priority of keeping their animals and people safe remains the same. Schultz says they aren't having as many visitors right now. But when they do come, they are washing their boots and hands and not in direct contact with animals. Even though Wisconsin is not one of the 8 states where cow herds have been impacted by bird flu, Schultz says she is taking all necessary precautions, looking out for symptoms, keeping the areas animals come in contact with extra clean, and making sure large groups of birds aren't hanging around the animals.
We as dairy farmers, we live, breathe, and die to take care of our animals.
Reporting in Fox Lake, Chloe Morrissey, 27 News.
Wisconsin has had problems with bird flu in birds in the past. In 2022, 29 flocks in 18 counties had infections. There's only been one major outbreak in our state this year. It happened in a commercial flock in Washburn County in northern Wisconsin, affecting about 41,000 birds.
The USDA will now require more bird flu testing in dairy cows. Now, the virus has been detected in cows in 8 states, including right here in Texas. This comes after traces of the virus was detected in grocery store milk this week. To talk more about the threat of bird flu, I want to bring in our medical expert, Dr. David Winter from Baylor Scott & White Health. Good morning to you, Dr. Winter. What is your take on this new information? Are you worried at all about drinking milk?
I'm not really that concerned. What they've found is fragments of the bird flu virus. No live virus, not in the milk, not in the dairy farms at all. So I'm not worried about that. We also have pasteurization on top of that. Now, pasteurization in this country kills viruses, kills bacteria. So I'm not worried about that. There's only one person in recent times who's coming down with this in America. We don't think he got it from milk.
Okay. What are some symptoms, by the way, of bird flu? How would any of us even know if we had it?
Yeah, this one guy was a cattle rancher in Texas, by the way. He had red, itchy eyes, lasted about a week or so, and he got well. Mild illness. The only other person, the only other individual in America was 2 years ago in Colorado, similar mild symptoms. So only 2 people in America, mild symptoms, came and gone. No big epidemic about that at all.
Okay, I just want to be extra clear with this. Do you feel like we're currently safe to drink milk as long as it is pasteurized?
That's the key. As long as it's pasteurized, no raw milk. Now let me add to that also. I think that steaks, beef, hamburgers, those are all fine also. No one has got it from cattle that we know about so far. So be careful with birds, though. That's what I'm concerned about. Right now, these wild birds have lived peacefully with the virus for a long time, but now we found some dead on the side of the roads. Don't pick those up. That might be a hazard, but only 2 people in America, so not a lot right now.
Okay. So as you know, of course, viruses have a tendency to mutate, change their characteristics, so to speak. Is it possible that the bird flu could change such that humans could be more susceptible, to it?
Yeah, Tashara, that's possible, but hasn't happened yet. Let me kind of compare this to influenza, the human influenza. The vaccines work very well to prevent serious illness. They prevent serious illness. Now, bird flu is not protected by the vaccine for humans. That doesn't work, but the drug companies tell us if they need to, the flu vaccine is easy to make. They could make one quickly that would be very safe and would protect that. But right now, only 2 in America, not a big deal. Drink your milk, eat your beef, and don't worry.
You basically just told the rest of us to chill on out. Dr. David Winter, thank you so much.
Chill on out. There you go.
Yeah, always a pleasure.
Thank you.
The U.S. FDA says that samples of milk taken from grocery stores across the U.S. have tested positive for remnants of the bird flu virus that has infected dairy cows. But the agency says it's confident the milk you are buying is safe. Officials also say the finding suggests the virus is spreading more prevalently among dairy herds than previously thought. To help slow that spread, the USDA announced today that dairy cattle must now be tested for the virus before moving to a new state. We're joined now by Dr. Jennifer Nuzzo, a director of the Pandemic Center at Brown University. Thank you for being with us. So let's start with the latest update. Particles of this virus found in commercial pasteurized milk. How concerned should the everyday consumer be?
I don't have any reason to be concerned at this point. Finding evidence of genetic material, which is what the test results told us, by itself is not alarming. In order to know if the virus will infect us, we have to do a different kind of test, and this test was not that. They're actually undergoing those tests now. But I don't have any reason to think that we will be harmed because we use pasteurization. And I have no reason to think that the H5N1 virus is any different from all the other pathogens that we think could be in milk. Pasteurization doesn't remove the genetic material of those pathogens, but it changes the pathogens and either kills or inactivates them so that they can't infect us. And I fully expect that that's what the test results will say, and just more reason to choose pasteurized milk over raw milk.
And yet we know that this virus is more prevalent in dairy cows than previously thought. How worrying is that, just the prevalence alone?
Yeah, so I am quite worried about that, but I'm not worried about that because I think it means something for a threat to the general public. I'm worried about it because it's an indication that we're not doing good enough surveillance to try to keep track of this virus, to stay ahead of it. And most importantly, we're not doing enough surveillance to protect the farm workers who we know are likely being exposed to this virus. So where I am worried right now is specifically for the farm workers. We've already had the report of one farm worker who was infected. Fortunately, it was a mild infection, but historically, people who have been infected with this virus have not experienced mild symptoms. So I am most worried about protecting farm workers who we think are likely having exposure to this virus, especially now that we are finding out that it may be in far more places than we previously thought.
Well, when it comes to the USDA doing more effective surveillance and communication, what does that work actually look like?
It means doing more testing, and testing of dairy cows up until this point, and even now, is actually voluntary. And USDA recommends only testing cows with symptoms. We know that that's likely not to be sufficient to detect the virus in all places that it is. First of all, you can only find it if you choose to do the test. And also we know that in North Carolina, when they tested cows without symptoms, they in fact found the virus. So if we're only doing voluntary testing, and if we're only testing symptomatic cows, then by definition, we're probably not going to find the virus until after farm workers have been exposed. Now, there was an important development to the day where the USDA said it would require testing of cows before they move between states. And that's potentially an important development, particularly if we think the movement of cows is what's spreading this virus. Unfortunately, we actually don't have a lot of data that tells us what is spreading this virus. So it's hard for me to judge how much of an impact this policy will have. I do think more testing is better than less testing, so I'm happy to see this, but I really wish we had more data that would give me more confidence that we are tracking this virus to stay ahead of it, but most importantly, to make sure that we're protecting workers who may be exposed to it.
And how prepared is the U.S. for the possibility of a still remote, we should emphasize and underscore that, bird flu pandemic?
Absolutely. Thank you for underscoring that. Yes, today I am not worried that we are in a pandemic by any means, but we should very much pay attention to this virus. We've actually been tracking this virus for more than 20 years. Some of these latest developments do increase my worry a bit. In terms of how prepared we'd be to respond, I mean, obviously we look back on what happened with the COVID-19 pandemic and we saw many challenges. Some of those challenges have been addressed, but some of them still haven't. Influenza is an easier case. When we started the COVID-19 pandemic, we had no idea whether we would have vaccines within a year. We already know that we can make H5N1 vaccine, so that puts us at an advantage. But there will still be challenges. It will take time to make enough vaccine for everyone. There will be challenges about what we do in the meantime. Influenza viruses typically affect the very young and the very old. So we have more high-risk groups than we probably had with COVID-19. So there are still some challenges to be sure. The reason why we are tracking this virus is so that we can get a signal of its potential threat, so that we can act very, very quickly to prevent the kind of harms that we saw in the early days of the COVID-19 pandemic, so that we don't have a repeat of that.
Dr. Jennifer Nuzzo, a director of the Pandemic Center at Brown University. Thanks so much for your time and for your insights.
Thanks for having me.
The bird flu has hit farms across the U.S., infecting millions of birds, several herds of cows, and even 2 humans. I'm with Connor from the Fact Check team, and how will grocery prices reflect this?
Well, we've seen this reflected in our grocery prices for a few years now. So a dozen eggs cost just $1.20 back in June of 2019. Then they steadily rose after the bird flu outbreak in late 2021, peaking at $4.82 last January. And that's all because at least 58 million birds were slaughtered last year to prevent more infections, giving us less supply for the same demand. Now, egg prices had started to decrease, but have steadily gone up again at just under $3 in February, and they may rise even more with this latest outbreak.
Right. We've talked a lot about eggs. Since this has infected cows, is there concern we will have the same issue with dairy prices?
Yeah, there is, Dee Dee, but the USDA has said the milk loss from the infected cows is, quote, too limited to have a major impact on supply, and that there should be no impact on the price of milk or other dairy products.
And what about safety concerns?
Another good question. So the USDA has said the chance of infected meat entering the food chain is low, and poultry and eggs that are properly handled and cooked are safe to eat. And another statement, the agency said there is no concern about the safety of commercial milk supply because dairies are required to send only milk from healthy animals into processing, and pasteurization has been proven to kill bacteria and viruses in milk.
All right, we know you'll continue to track this, Connor. Thank you. And for more on this Fact Check team topic, including links to their sources, scan the QR code on your screen or visit thenationaldesk.com.
Texas health officials say for the first time in the U.S., a human has contracted the bird flu from a dairy cow. They say the chances of it happening, though, are low. And the milk you buy at the grocery store, well, that's just fine.
But the unusual symptoms from the patient had is something they say doctors should be looking for. ABC 13's Nick Notario live in the newsroom to explain. Hi, Nick.
Hi there, Mara. You know, the state put out an alert not just for the public, but also for doctors. And here it is right here. And they did so because of the symptom that this dairy worker came down with. He only had an eye infection, and they say that there are a number of other symptoms that are much more common with the flu. And as the state puts out alerts like this, it's also monitoring to see if the situation gets any worse.
What happened in the pastures of Texas Panhandle has caught the attention of health experts here in Houston.
It is certainly very important that public health keep an eye on what's happening, but right now there's no cause to panic.
Last week, the Texas Department of Health and Human Services says a dairy worker was tested for bird flu. Over the weekend, the CDC confirmed the positive case, the first human one in Texas. State health leaders say the sample showed no mutation. Right now, they're monitoring dairy workers. More ways to catch possible spread are coming.
There's also some work that's being started in the wastewater surveillance program that the Texas Epidemic Public Health Institute here at UT Health Houston has.
One way the flu can spread is through milk. Officials say you should not drink raw milk. However, they stress what you buy at the store is safe because it's pasteurized.
Pasteurization, it just means the fancy word for heating up the milk to a very hot temperature for a certain period of time when we know that it will kill bacteria and viruses.
The sick worker is currently taking medicine. While they do, officials are still trying to figure out how a cow got them sick.
That's still a question that we don't have the answer to right now, and something that we're hoping to find out.
A rare case in the Panhandle that officials say doesn't change the risk for the public, which remains low. Nick Notario, ABC 13 Eyewitness News.
The FDA is warning people about a highly contagious bird flu that's showing up in milk samples. Corey McRae spoke with state leaders and local farmers, though, who are not sounding the alarm because of the process that milk goes through before it hits the shelves.
The U.S. Department of Agriculture, FDA, and CDC are investigating the outbreak of bird flu that has impacted dairy cows in multiple states. According to the FDA, the infection is causing decreased lactation, low appetite, and other symptoms in affected cattle. Despite the spread, the FDA and USDA indicated that the commercial milk supply is safe, citing the pasteurization process and the destruction of milk from sick cows. Honey Creek Farms in Petersburg echoed those words.
We're blessed to be in the U.S. because we've got some of the strictest standards in the world. Every sample of milk, when it goes to the dairy to be processed, is tested, sampled. It goes through the pasteurization process. So it's safe.
If a virus is detected, pasteurization breaks the pathogens down to a level that would eliminate any harm to humans.
It heats it up. It goes up to at least 165 degrees, and that kills all the germs that are in the milk. And then they cool it back down, and it's a quick process, so it doesn't take out all the good nutrients in the milk.
Having 40 cows on the farm, Howard says they are able to monitor the health of each cow and can call on the assistance of a local vet if needed.
We keep track of it all. If the cow's sick, we treat them. That milk doesn't go in the tank. And then when they're healthy again, it goes back in. And
truck drivers that transport the milk from the farm also collect samples, another layer of protection prior to the pasteurization process. With more local news, I'm Corey McRae.
America's dairy cows will be tested for bird flu more closely to stop the virus from spreading. Some new rules were put in place yesterday after the FDA reported finding fragments of the bird flu virus in pasteurized grocery store milk. Regulators, though, say there is little risk to humans. Dr. Celine Gounder is a CBS News medical contributor and editor-at-large for public health at KFF Health News. Good morning, Dr. Gounder. First, I want to just ask you about that headline. When I first read this yesterday, of course, you know, alarm bells go off when you hear that it's found on the grocery store shelves in pasteurized milk. What concerns should we have? Should we have concerns?
Yeah. I think we should be very clear that the tests that came back positive are for the genetic material of the virus. This could just be virus fragments, what's left over after pasteurization. And so this by itself is not a reason for alarm. There are additional tests being done to see, is this live infectious virus or is this just the dead virus we would expect to see?
So drinking it, would you get sick drinking that milk?
Well, presumably, if this is simply the leftovers after pasteurization process, you should not get sick from this.
All right, and we know that H5N1, the bird flu virus, it's out there. It's in the animal population. But when it comes to human risk, there has been only one confirmed case, animal or a farm worker in Texas who is a confirmed case. So what can we gather from that when it comes to human risk of transmission?
Well, there are some tests still ongoing, so to see if there's any live infectious virus in the milk supply. So what we do there is we try to grow up any virus, what we call culture. It's the kind of test we do. Those tests are still ongoing. We anticipate those will come back negative. Pasteurization works for all the viruses that we've tried to test this on so far. There's no reason to think it wouldn't, but we want to confirm that that's the case. The other thing we're looking out for is, do we see pigs infected? Pigs have traditionally been the mixing vessel for human and bird flu, and that's how you get these Frankenstein scary flus. That's what we have a bit of a blind spot on right now, and so we need to be digging more into that.
Is the government doing enough, and the FDA and farmers? What are we hearing about how these cases are being reported or how they're taking care of this?
You know, big picture, I think there could be more transparency and cooperation, whether it's the USDA or farmers allowing the USDA and public health people onto farms to do the testing. Some of the workers are not trustful of the government and so don't want to come forward for testing. So everybody needs to be working better together.
All right, Dr. Celine Gounder, thank you so much.